So welcome again, everybody. Today is the official design challenge kickoff day. It's Monday. So we're currently on October 6th, and it's the first day of the challenge. And our first session will be sharing the programming with Michelle Haaff from Biodesign at Stanford, and she will be hosting a workshop on Needsfinding. Um, so so some logistics here. Our demo day is going to be on the 17th, which is next Friday. And we have, as you can see, we have a full programming happening in the next 2 weeks. Some reminders, as Richa mentioned last Friday, we have some deliverables to do. And specifically for tonight at 11:59 p.m. PST, you have the mentor preference form, as well as a when to meet to find hopefully better time for people in different time zones to meet. And uh, I guess some preview, we have the team one pager due on October 11th and your recorded practice pitch on October 14th. And demo day is on 9 a.m. to on the Friday, 9 a.m. to noon p.m. PT, which by the way, Michelle, we would love to have you. All right, without further ado, let's get to the session. So I'll be introducing Michelle. Michelle Haaff has almost 30 years of experience in Silicon Valley. She started as a product manager and ultimately came to lead both large and startup companies. In digital health, she has led multiple clinical efficacy studies with large device and pharma companies and has put multiple products through the FDA clearance process. She is currently the Assistant Director of Digital Health in the Stanford Design Department, teaching the biodesign for digital health and biodesign for underserved populations each year. She also advises emerging digital health companies. Without further ado, I'm going to pass it on to Michelle.
Thank you, Sherry. It's great to see you, and it's great to be here with this group. Congratulations, all of you, on participating in the Stanford Healthcare Design Challenge. It's an exciting program, and I'm thrilled to be a part of it today. Hopefully, this kickoff will help you through your process. I'm going to give you a little bit of background on biodesign and the process of identifying unmet needs. So as you think about your projects, and many of you already have a sense of the problem areas you're going to look at, Biodesign provides a process that allows you to look at those problem areas and discover the unmet needs in those problem areas so that you're solving for what the market really needs. And so a lot of teams, a lot of founders, a lot of innovators will approach a problem from one of two ways. They either have an incredible idea from a problem perspective. They've experienced a problem, and that problem meant a lot to them, and they want to help solve it. And the others tend to be more technically focused, right? They love technology. They want to leverage technology to apply it to a problem. And so we're going to talk about those two approaches and how really understanding problems and unmet needs allows you to deal with the complexity of healthcare and solve problems in a very deep way, and also gives you a fighting chance in the complexity of the healthcare world and the healthcare stakeholders to bring a product to market. So I just see something in the chat. I just want to make sense. Yep. Please feel free to post questions in the chat as we go. Happy to answer them during as well as after the presentation. So the Biodesign Department is an interdisciplinary department inside of Stanford. We bring together students from across the university, the med school, the business school, engineering, public policy, law, all over the university to explore healthcare problems and the unmet needs that go along with those problems in pursuit of identifying solutions using a user-centric, user-first design methodology. As an organization and as a team, we value collaboration, diversity, empathy, innovation, integrity, and leadership. And we always talk about these values when we begin a presentation. Our goal is to advance health outcomes, improve results through innovation, education, translation, bringing things to market, and policy. We teach across the university, and any of you who are still in the university, no matter where you are welcome to take our courses. Sherry and Risha were both students in the Biodesign for Digital Health courses, and I would guess many, or at least some of you affiliated with Stanford or in the university, have taken one of our courses. We offer mentoring and acceleration programs, as well as seed grants. We have been involved in 57 at least companies. I think there are a few more actually that have gone through our process and have been able to bring those products to market. So these are all companies that have been funded. We also coach and teach our process to large organizations. And so there are people inside of large organizations in the health tech industry who learn our process and then apply it to their product development processes. And just from those 57 companies, we believe 18 plus million people have been helped. And that's truly our goal, is to have real patient outcomes at the end of the day. So we're constantly monitoring that as an organization. So I talked about this when in the opening. Many companies and many founders fall in love with the technology. They're like, oh my gosh, I've got this AI, this ability to use LLMs using health data, and I think I want to apply it to this problem. And there's often been an imbalance in that world where you go from a technology and you're trying to find the round hole that maybe your square peg of technology fits in. It's kind of like this, if we build it, they will come mentality. And we at Biodesign take a very different approach. We're focused on need pull. We ask innovators to really look at the problem area, study it, and identify the unmet needs in that problem area. What might not be working in the way a therapeutic, an intervention, a diagnostic, even a healthcare workflow, what might not be working in those processes, in those interventions that could be improved through innovation. So it's a kind of a different mindset. And the reason why we hold this mindset almost religiously is because we really believe that if you focus on the problem and use technology as an enabler, you will have better traction and better ability to handle the complexity of developing for the healthcare world. Our approach is very user-centric, so we use design thinking, and I'll take you through that approach in this conversation, where you really empathize and understand the problem area. You define it clearly so that your whole team understands and is marching to the same understanding. You ideate, prototype, and test on an iterative basis until you're able to validate with your users that you've come up with a solution that meets their unmet need. So in the healthcare world, unlike technology, there are so many stakeholders that play a role in engaging with and in approving an innovation, in enabling that innovation to come into market. Okay, so obviously clinicians play a role and patients play a role. And in most tech, it's like, okay, it's our users, and I'll look at the clinicians as the companies that would say, oh yeah, I can use this to offer a solution to my customers, to offer a solution to consumers. But in healthcare, there are many more stakeholders that play a role in getting your solution into the market. Everything from the government through policy to payers who actually pay for the solution, to the media who talks about the solution, to the regulatory systems who actually allow for those solutions to come into market safely, to the politicians who put forth laws that maybe control the market, control those solutions, and allow for those solutions to get paid for, all the way through to integrated delivery networks, insurance companies, healthcare providers. And so to be able to live in a world of this complexity with so many stakeholders and so many drivers, including outside drivers like the social determinants of health, we offer a methodology that allows innovators to really understand all those stakeholders and the problem area in a deep way, to be able to develop a solution that will really meet the needs of the market. And so our solution has 3 steps: identify, invent, and implement. And they're iterative steps where you're actually going out and trying to engage in this process we call needs finding. This is really the process of deeply understanding your market and the problem area so that the solutions actually crystallize for you. And you're able to organize your understanding of that problem area in a way that allows you to screen out to a concept, validate that concept back with your market so that you can ultimately implement it and bring it to the market. Okay, so I'm going to talk a little bit about what this process is and how it works. First step, need finding. And the idea is when you look at a problem, a trap that we see innovators get into is they take a look at that problem, maybe they read about it through secondary research, maybe they've experienced it themselves, and they start ideating solutions at this very early stage. We encourage innovators to wait on solutions and to dig deeper and deeper into the many layers of the problem to identify a slew of unmet needs in that problem area that you might put a solution forth to solve. And so we ask you to be solution agnostic from the beginning. The goal of need exploration is to identify a diverse set of compelling health-related challenges that represent opportunities for innovation. And it relies on all different kinds of techniques. So not just your secondary research, not just your personal experiences, but a whole immersive process of understanding the problem area with a set of diverse people. That's why we bring, it's interdisciplinary, just like real life companies are. We bring people from different backgrounds with different expertise areas, different sources and different environments to allow you to really understand that problem area. And the needs uncovered serve as a foundation for all the steps in the process. And it's iterative, so you will come back to those steps many times. Need exploration borrows from ethnography and user research. So from ethnography, we often encourage innovators to really seek out an objective way of understanding the problem, whether it's through engaging inside of the area that you're trying to solve. If you're trying to solve for problems and workflow problems in the ER, it's actually experiencing the ER and experiencing those workflow problems. If you are looking at a problem that takes place in the operating room, it's observing how clinicians work in the operating room. It's observing what comes before during the diagnosis process and downstream after in the recovery process. It's maybe even observing upstream how you can prevent the issue that caused this surgery in the first place. So the idea is to really understand the end-to-end process in depth through ethnography, as well as then user research, which is borrowed from the design community, which seeks to yield insights and other critical information that helps you guide the design process. Okay, so that user research is interviews, it's discussion groups, it's observations of the unmet needs in the problem area that you're pursuing. Okay, unmet needs should be considered in 3 dimensions using our methodology. The first is the problem, okay? The basic issue that is somehow limiting either quality, accessibility, or the affordability of care, okay? So as you all are thinking about your problem areas and the ideas you have for this design challenge, I implore you to really write up what that problem is and explore it and understand it in depth. The next is the population. Well, who are the folks who are going to benefit, or who are the folks most affected by this problem area? Okay, who are the stakeholders in the groups experiencing this problem area? And again, I implore you as you're doing this to map out the different stakeholders that might look at this design challenge, look at the results, your solution that you're coming up with, and experience them in some way, whether they're a user, whether they're a contributor, whether they're a decision maker, if it were something somebody would purchase, whether they are prescribing it, whether they are involved in the workflow of it, really understanding that population that's affected by the problem. And then ultimately, the need statement includes the outcome, the positive change you want to make by creating the solution. And when we talk about outcomes, it's really important to have something that's measurable so that you can actually say, hey, if somebody used our solution, and they got this particular outcome. They had lower blood sugar. They had better throughput getting through the emergency room. They were able to get good post-operative care. Whatever problem you're looking at, you want to make that measurable so that you know if your solution actually worked. But your measurement, your outcome, also has to be something that the market actually cares about and has value in, okay? So these three elements will eventually come together in the form of a need statement. I mentioned before, interdisciplinary teams are key. Bringing the experiences, the skills, the points of view from people with different backgrounds allows you to see a problem from different points of view. So I'll use a personal example. I worked in the diabetes space for many years. I am not a clinician. Most of the people in the organization I worked with were either clinicians or software engineers. Well, I was a business person who had family members with diabetes, and having my ability, having the point of view of different people looking at the diabetes problem from different points of view allowed us to understand that it wasn't just measuring blood sugar. It wasn't just the code to actually upload blood sugar data easily, but I was able to show through an understanding of process how the process was broken in reporting blood sugar data. So different people with different backgrounds give a different perspective to the problem area, and also allows you to identify unmet needs when you're observing through ethnography and user research, things that maybe one of you might not have noticed. Okay, so a need statement. We talked about it, a way to address a problem in a specific population in order to achieve a desired outcome. Okay, so let me give you an example. Here's a way to increase access to healthy food for people in underserved communities to reduce onset of chronic disease. So I might add the rate of onset of chronic disease. I might even add a metric to reduce the onset of chronic disease by 50% in people with underserved communities. The most important thing in this is there's no solutions allowed. So our methodology implores you to really focus on that problem, who it affects, and what outcomes you might want to be getting before you think about solutions. So that when you do think about solutions, you're really focused on what the unmet needs that need to be solved versus an idea that you had that might not necessarily connect with the problem area. So it really pushes you to understand the problem before you start to ideate on solutions. Your first draft of a need statement is a hypothesis that you'll then go back and validate. And we actually, because we encourage you to identify lots and lots of unmet needs in the problem area that you're looking at, we take you through a process to actually screen to the best few needs. And how we have you screen is we have you look at 4 areas: the problem fundamentals. So this is like, why is the problem there? What are some of the maybe physiological drivers of the problem if it's more of an intervention issue? What are the process issues? Why does that problem exist? We have you look at the existing solutions to that problem. Is there a workflow tool in there? Is there a device that is currently used that might be suboptimal? Is there something that's doing a great job, but it just costs a lot of money and is really hard to use? We have you look at the stakeholders involved in the problem. Who are the different stakeholders? What are their roles? How do clinicians play a role? How do patients play a role? How do administrators play a role? Family members, caregivers, social services, et cetera, et cetera. And then we have you look at the different opportunities in the space and see what's out there, but also see what hasn't been done. And the idea is you take these 4 areas and it allows you to actually screen down to the best few needs, okay? Oh, here's an unmet need, but there's a solution out there that's very inexpensive that's getting improved that I think will solve that need. Okay, we're not gonna look at that. Let's look at another unmet need in our problem area. And you go back and forth between these investigation pillars and your list of problems that you want to solve in that problem area, the unmet needs that you want to solve, until you hone in on something that makes the most sense. Part of that process is maybe need scoping. So you could play with the focus of your problem, population, and outcome, scoping in and out and experimenting with different levels of specificity, okay? And you can consider superseding needs. The idea is to find that sweet spot and a need that is detailed enough and actionable without being too limiting. So if we go back to that need statement around improving the access to healthy foods for underserved populations to reduce the onset of chronic disease, you could scope really big. Let's just stop hunger in general and scale the distribution of food. Or you could go really kind of smaller and more specific, provide affordable meal planning to that population. And you could go somewhere in the middle, increase food bank coverage in the area. And there's probably many, many other middle areas. You want to really focus in on the unmet need, like I said, that is detailed enough and actionable enough. So stopping hunger, oh, that's a big problem, without being too limiting. You don't want to do something that's so specific that you are just a feature in maybe a larger solution. So we ask you to kind of look at the different levels of the problem and try to find a sweet spot of how that, like kind of, if you look at a workflow of a problem, what piece of that problem do you want to solve? And it's big enough that you could actually have an offering that would ultimately downstream generate some income. So an approach to filtering, so you've got all these different needs and you're trying to get down, we want you to first, at the very high level, make quick decisions. Okay, there's many other needs like this. Is it a big market? No, okay, we're not going to use that. Is it a real need, or is it just like a small problem? Is the team interested in this? And passion, I can't underestimate, if you're not interested in exploring a problem, how hard it is to actually get up every day and work on it. So that's a real critical thing when you're looking at a lot of problems, a lot of unmet needs. As you get further and further down your list of problem areas, you get a little bit more empirical with analyzing which problems, which specific unmet needs you want to focus on. As you get to the few problems that you are looking at, you're going to want to do a more empirical analysis, looking at market size, number of patients that are impacted, number of providers that might be impacted. Are there other solutions out there? Is that need being met partially by somebody who might have a roadmap to completely fill it? What is the feasibility of solving it? If we did solve it, could we solve it with something that's differentiated? Could we have some IP behind it? Okay, so you can rely somewhat on intuition, using what your research showed in those 4 pillars, helping you determine, okay, I found something that's of a decent size, that has a decent market size, that impacts a decent number of patients, that the need hasn't been fulfilled yet, or it's being fulfilled in a very expensive way or in a very cumbersome way. And that's where you should focus. Okay, then for the top needs, you start to look at criteria. So if I were to, maybe you pick 3, 4 needs out of all the unmet needs you listed when you did your research. Okay, we want to solve this aspect of that problem, the workflow in the emergency room, or we just want to solve getting maybe high acuity patients in quicker, or getting certain patients sent home without actually having to have an intervention. We want to move them into our hospital at home workflow. In that particular area, you might look at a small piece of that problem or the whole piece of the problem. But you might want to look at a few different problem areas within the area you're looking at, and you create what we call a need criteria. This is a short list of requirements that any solution must offer to satisfy the key stakeholders. So again, I'm not talking about technology. I'm not talking about AI or cloud or a device or other interventions. Just list in plain terms what would be required, what must-have features would this solution need to have to be able to solve the problem, and what would be nice to have. And that will be another way for you to filter out whether you can actually solve the unmet need. You might say, oh gosh, we're going to need to, dramatically change the workflow in XYZ process to solve this problem. Gosh, that's going to be really hard. And it's going to be a really long sales cycle to get healthcare provider to agree to that. Let's put that problem aside and focus on something else. So really analyzing what it would take to actually solve the problem will help you determine if you want to go down that path. So what might need criteria look like? If we go back to our original need statement, a way to increase access to healthy food for people in underserved communities to reduce onset of chronic illness. We know, particularly for working with underserved communities, that a must-have criteria is the food must be at a reasonable price. So if the food was really, really expensive, but maybe available in community next door to an underserved community, but it was too expensive, that community couldn't access it. So we know it has to be at a reasonable price or free, at or below the market rate. Food must be healthy and fresh. So maybe we want to increase access to food, but having chips and soda at the new corner, having that delivered is not going to meet the need. So in this case, it has to be healthy and fresh. It has to be compatible with the daily lives and experiences of the users. And so we find with underserved communities, they tend to be in food deserts. And so the one of the need criteria is that the food actually has to be available, maybe accessible via SNAP could be another one of the need criteria, and available in community. Experience. So maybe it should leverage existing systems. Maybe we found that this population either doesn't have access to smartphones or doesn't like using certain apps to do things. So it should leverage maybe existing systems of food delivery, should require little effort in the community, quick to get. It should be easy to onboard. So what we found out through research is that these communities had very little time, working oftentimes 2 jobs, taking care of families, and didn't want to sign up for a long, complex process or something that they didn't trust. So you start to kind of hone in on what the solution has to have without actually talking about a solution, so that when you do talk about a solution, you have a set of criteria, you have a set of parameters that you can use when creating that solution and coming up with those concepts to validate with your market. Then stage 3 is concept generation. And what we're showing here is actually a real biodesign team going through the brainstorming process with all of these different inputs. What could a solution be? And you actually go through a variety of different ways of brainstorming. And what we encourage teams to do is encourage wild ideas, defer judgment. We hope your teams will do this. Discuss the ideas as headlines. Don't get too caught up in the details. I can't tell you how many times I've seen teams, somebody mentions something and somebody else on the team perceives it to be something else, and they don't give that team member a chance to really explain it and to break down what the idea is. They judge the idea quickly. Maybe certain wild ideas, they say, oh, we can't do it. It's kind of too outside the norm of what's being done today. We encourage you to kind of tackle each thing pretty broadly, look at the problem, and then hone in on ideas together. Reflecting on each brainstorming session is just as important. You want to organize your concepts, identify knowledge and gaps, plan to address those gaps, and test them against your criteria, test them against the insights that you got from the unmet need research, from your need research, and circle back and iterate through until you find concepts that are a really good match with the unmet needs that you've discovered you want to solve. Then you filter down your different ideas, your different concepts, filtering down to the most promising ideas. And filters could be intellectual property. Oh gosh, somebody else has a patent on this. Or, it would be something, if we created something for this, it could be patentable on our side. If we created this particular solution, it would require a real regulatory pathway. We would need a lot of patient data. We would need to develop an algorithm that would need to be efficacious. So we need to do a clinical study. We would need to go through a software as a medical device process. Do we want to do that? Maybe yes, that could build a moat around our solution and allow us to have better time to market. But that could also be really hard. So maybe we start small and go big. What's the reimbursement landscape for the product? Now, I'm not saying you have to have reimbursement, but are there other corollaries in the market that have been reimbursed? And could you actually take advantage of those corollaries out there and get reimbursed for a solution as well? What are the possible business models? Is this something we would offer directly to patients? Would they be able to pay for it? Or would they expect insurance to pay for it? Ooh, sorry. I'm going backwards here. Is this something we'd offer to clinics? Is this something we'd offer to the IT department of a hospital? Do they actually have a way to buy it today? If they don't have a way to buy it today, what budgets would it fit into in the future? And is it technically viable? We have this big vision. Could we actually implement it technically? So when you start to look at your concepts, you're going to want to run it past these different variables to say, okay, with just enough research, it doesn't have to be perfect, but you need to have a general sense of these questions so that you aren't hitting a lot of friction as you develop your solution downstream. And screening can be progressive. Over time, you'll gather the information you need to determine which solution you should take forward to the market. You will actually go back out into the market and maybe even talk about different concepts, helping you get down to a viable concept where you get to the leading concept and your finer concept that you spend all your time on. And again, this process is iterative as well with your market. And by the way, I've seen a lot of companies actually get funding on an early initial concept selection, an early idea. And then once they get into the market, they actually end up honing in, pivoting to a new idea because one of these items, there isn't a business model for it, or it doesn't fit into the workflow, or the regulatory process is too hard. So we're going to pivot a little bit to something that doesn't require a 510K, but that fills the unmet need or part of the unmet need. So there is some iteration here. And we want to save you from as much of that iteration downstream when you've spent money and you've got the pressure from maybe investors or the market. We want to save you some of that time and have you do that earlier in the process. And then stages 5 and 6, implementation and planning. Once you've really identified an unmet need that you want to create a solution around, you want to develop that go-to-market strategy and business plan so that you can get out there and do well. So factors to consider: IP strategy, developing a moat, R&D strategy. How are you going to actually iterate and improve on the solution over time? Is it SaaS-based, for example? Are you going to update it every week? How would that fit in with a regulatory strategy? How would that fit in with sales and distribution? Do you need, for example, clinical strategy? Do you need clinical research, efficacy data to get clinicians to buy in to and use your solution? What does quality management look like in relation to regulatory, in relation to things like HIPAA compliance? How are you going to get paid? And this often iterates quite a few times. Will you get reimbursed? Will there be partners who actually might pay you, a pharmaceutical company, a device company? Will consumers pay for it? Will you come out of maybe an IT budget or a social services budget? How will you get paid? What's your market strategy and your sales and distribution strategy? Do you need a lot of feet on the street to sell this? What is your cost of customer acquisition, your CAC? Who will bring this to market? How can you get support for bringing your product to market? And then you integrate that into a cohesive plan, the best pathway to reach the market. Startup, a license, a partnership, how much time and money you will need to realize your chosen course, where the money will come from, and the story you'll use to attract investors, talent, and other supporters. And so I went through quite a bit. There's a whole set of resources on the Biodesign website that you can, for free, you just sign up and give us your email address so that we can send you emails if new content's available. We go through every step in this process in great detail with lots of videos, case studies, how other founders have done this work and gotten to where they need to be. So I understand that this group is doing this on a very tight time frame, and we have our classes do this kind of work also on a tight time frame. And I'm here to tell you, you can get through this process at a high level in 6, 7, 10 weeks. You will likely, it'll give you a chance to actually practice going through the process of really understanding the market, maybe prototyping a solution and bringing it back into the market to validate it. And then if that solution gets some interest, if you get people saying, hey, I would love to see and learn more about this, I might be willing to invest in this downstream. You would actually likely go through this process again once you've gotten some market validation to really validate, okay, am I solving this problem in a way that meets the unmet needs? So I just want to take you back to the process one last time. Okay, so I am gonna kind of open up, see if there are any questions. I know this is being recorded and the big group isn't here, but if there are any questions, I will stop sharing and come on for questions. Okay, Sherry, you want to share some maybe an experience you had going through this process and
Yeah,
yeah,
I guess I was going through it. I feel like my learning was actually very different now that I hear back the second time. Because we also, so for us, we designed like a remote control monitoring sort of digital health tracking system. And now I guess first like when I was like listening to your lecture, I was like, wow, there's like a lot of flashbacks, but there are also so many things, especially when you're talking about like who are your payers, who are the pharmas. I was like, there are actually a lot more things to consider in the process, and you'll probably be going through this like multiple iterations, even if not hundreds. It's probably like a constant, like habitual thing to do almost. You want it to become like a mindset. Um,
yes,
I was actually curious, Michelle, how would you advise them when they think about some of their local communities? We have people who are just down at who are trying to address issues regarding like sexual violence down in LA for immigrants. We have people from Africa, from Europe, and I guess when they think about their local communities and like in terms of how do you think about the business models? Do you have any advice how they
sure.
go about and address those and do research?
Sure, sure. Actually, our Biodesign for Underserved Communities more broadly looks at problems that happen in community versus in the healthcare system when you're getting an intervention. So, for example, that sexual violence team, as well as all the teams, volunteer. If you get a chance to be out there in community, seeing the people affected by the problem area you're interested in, talking to the people who help them throughout their process, community-based health workers, people who provide community support, people who provide, in the case of sexual violence, therapy. You could learn so much. So I really encourage all the teams. That's one example, but depending on the problem area you're looking at, get out there and try to understand the folks who are experiencing the problem, the people who are trying to help them with that issue. And one of the best ways to do that, that's why it's not only design thinking where you're doing interviews and you're engaging with them maybe through social media, um, watching videos about them, joining them in group, but volunteering as well is a really fruitful way to see a problem firsthand, to give back, to understand what the unmet needs are for those folks in kind of a first person real way. Second piece you mentioned is business model. And so for those looking at social determinant type problems, there is a decent amount of money out there, although it's constantly shifting in the United States, but money out there. Section 1115 of the Medicaid provision from CMS provides for the social determinants of health and gives reimbursement to community-based organizations for a variety of different interventions and related to the social determinants of health. That is food, access to healthy food, housing, mental health, transportation, family care. There's some of those are really covered through Medicaid. Of course, they differ state to state, but there is reimbursement for that as well. And so I encourage students who are looking at kind of social determinants of health type of problems to really think about how they're actually maybe not only creating outcomes and supporting the individual patient, but how their solution might save money and increase velocity in the system for supporting those patients so that you can kind of triangulate to a business model. And that business model could be reimbursement through government healthcare because, wow, you're saving them money by maybe getting them care intervention earlier, cheaper, faster. Or it could be a way to actually generate income. So there are tons of FQHC local clinics that provide care for these kinds of things. Are there new things for them to bill for that allows them to provide the service back out to patients and allows them to actually grow their center and get more income to support more families? So you really have to kind of look at the problem from a variety of different perspectives to see how reimbursement might work. How can one set a specific market revenue? So that's an interesting question. You know, there's a couple of ways to triangulate towards what the total addressable market will be for a problem area. Okay. And I think that's what you mean by a specific market's revenue. One of the ways to do it, and there are ways to do it from tops down and bottoms up, right? Bottoms up is like, okay, how many health clinics out there experience this problem? How many patients experience this problem? Okay, what is the current interventions today cost? How many people actually reach the required need, or they reach the criteria for getting that intervention? And then you multiply those two things, and that's how much possible revenue there could be in the market if we came up with an alternate solution, right? You can also do a top-down approach, looking at the potential market revenue in terms of how much money exists out there for this particular problem area in the market today, or what is the total, number of people in the world who might have this problem today? How is it paid for today? That's my total market opportunity. So you look at total addressable market, and then you want to look at your serviceable market. And so the problem diabetes could be, big market. And then you might get into a specific problem area inside of diabetes. And then you want to look at your serviceable market. With the solution you have, what piece of the market will you get? So I'm not solving all of diabetes, and I can't I'll look at the United States, the 40 million people with diabetes and the amount it costs to serve them. I'm not curing diabetes, but I'm solving this little piece down here of diabetes. That's my serviceable addressable market. And so there's actually in that kit online, in the Biodesign kit that I showed the slide on at the end, the user guide, there's a whole set of written case studies and examples, videos, and actually like a mini lecture on how to come up with market sizing.
Yeah, and Michelle, is it okay if I distribute that? Maybe I can share some part of the PDF or your presentation.
Yeah, I'll send the presentation over to you to share, and a link to the Biodesign user guide.
Perfect. And I think, Abdullah, you had a question, or I saw you unmute. Do you have a question? Okay, maybe he doesn't. I guess I was thinking maybe if people have specific questions and don't want to share their actual ideas in detail, I can pause the recording and potentially maybe if anyone wants to come out for that. So
these are socialized medicine. Okay. So the question is, how outside of the US can you actually identify business models and opportunities for solutions for underserved communities? Yeah.
Yep.
And so outside of the US is actually one of the harder places because of our public-private reimbursement system. In most countries in Africa, there is some private healthcare, but most people who are low income and middle income receive care entirely through the public systems, public hospitals, public, I'm going to call it insurance. Okay. And so those organizations cost a lot of money to provide solutions, okay, to their citizens. And so I definitely looking at problems that are really have a lot of friction, have low velocity, and are expensive on a number of fronts. So it could be economically expensive. It could be a combination of economically and expensive in terms of outcomes, right? So maybe, for example, things like birth rate, mortality rate for women who are having children, the rates are way higher than the United States. And so why? What does it cost the health systems in the example I'm giving in East Africa to deal with some of the friction that takes place that ultimately leads to bad outcomes? And could you create solutions that lower costs and provide better outcomes? So all the more reason to go back to that biodesign process, really understand every step of the problem. And a lot of times the problems happen well before the intervention, well before that individual gets to the hospital. It could be not being able to afford vitamins if we're talking about pregnancy in women. It's maybe not being able to get a ride to a well care visit, right? Maybe not knowing about it, or not being able to sign up for it because you lack internet, or you're not allowed to use the internet, or you share your phone with, there's one phone shared across the whole family or whatever. And so really breaking down that problem and understanding those friction points, very process-based, and identifying places that are high friction and that ultimately downstream cause a lot of pain as it relates to economics. It's costing the government a lot of money to take care of these women, to take care of all the complications that happen, and the outcomes are horrible. Focusing in on those problems and ways to solve those problems, very powerful. Because in most cases, particularly in East Africa, the government pays for these kinds of solutions if you can prove you've actually saved time, saved money, improved outcomes. Okay, what indicators or user feedback would show that a solution or product will meaningfully improve the problem before full implementation? Oh, that's great. So there's a wide range, right? Obviously, just talking to users and understanding from users, one, whether they think the solution would solve the problem is like very, very low bar, all the way through doing studies. So depending on your solution, if it's an intervention that requires some regulatory oversight, whether it's a 510K for software as a medical device, or whether it's a solution that requires kind of efficacy data for a physician to adopt, the results of your study could be really good indicators that would show that a solution would improve the problem area, right? So you actually will have to come up with a measurable analysis, right, of whether that could be done. If your solution is more process oriented, it's like you're one step in the healthcare process or the registration process or whatever, getting some case studies and pilot data would be very important for you to be able to actually then bring that to market and sell that item. But on the early side, when you're saying, okay, is this idea worth pursuing? You're going to get a lot of people who are super supportive and say, yes, actually, you have identified a problem that's really, really bad. And I want you to solve this problem. And if you get a lot of that, a lot of positive signs, you got to ask the next question, which is, would you pay for it? And how much would you pay for it? And if they say, no, I wouldn't pay for it, the reason could be that they just don't pay for anything because somebody else pays for it, right? It could be reimbursement. It could be the hospital. It could be some social service that pays for it. And so you're going to want to really dig deep down to see who pays for things like this. And if you had this, does this item, does this solution create the outcomes needed to justify them paying you for your thing? So I see a lot of innovators get a lot of positive buy signs from people, clinicians, maybe even patients who are like, that's really cool. I like that. I like that. And then when they ask that question, okay, would you pay for it? And how would you pay for it? Like, out of what money would you expect it to be reimbursed? Would you pay out of pocket? Could we get some of the operations budget for it? Could we get some social services money? Could we get a partner to pay for it and distribute it because it's going to help their product do better? You know, could we get somebody to deliver this through their channel? All of these kind of business model things really become important then, because it's not just enough. It's important in the beginning for them to say, yeah, that's cool, I would want that. But then they have to go further and say, yeah, and actually, here's where it would fit into our budget. Here's how we would pay for it. So your early questions are going to be about the problem in your early interviews. And people are going to be like, yeah, you got the problem right. Yes. But before you get to really developing a concept, you're going to want to ask those questions. Okay, where would this fit into your economics? How you'd pay for it?
Wow, that's super cool.
Okay, this is only the beginning, right? How long is this program?
It's for 2 weeks. So the last day is demo day next Friday. However,
Okay,
the beginning for the selected team to begin their 3 months process where we'll support them through.
wonderful.
Yeah, so very excited to
Yeah.
see people's progress in their one pagers. Yeah, we're implementing the one pager and executive summary too.
Yeah. I would say because part of this process is coming up with some, like maybe a prototype or a drawing of what you think the solution would be. Use data, not just intuition, but use data, your understanding of the market, research, even if it's just online, primary research by engaging with forums. Patients Like Me is an online forum. Use that to help you decide, okay, this should be included. Because you will get a real better understanding from the market than just from your gut as to whether you should include something
Yep.
for this 2-week process. Yeah. And then I'll be here if anyone has questions.
Michelle will also be one of the mentors. We're very grateful and lucky to have Michelle. So if you guys have any questions, we can also follow up. But for today's session, this will be all. Thank you again, Michelle. Really appreciate you for this mini lecture. And yeah, we'll conclude here. For the
Wonderful.
rest of the team, please remember your deadlines, which is tonight at midnight. And I'll see y'all soon. All right. Thanks, y'all. Bye.
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 Thank you, ma'am.